COVID-19 pandemic has taken the world by storm. This massive outbreak of over 63 million cases worldwide have affected virtually every sector that intersects with how we live, socialize, and work. This dramatic change in how we live is largely due to social distancing, which is one of the most critical measures to control the upsurge of COVID-19 cases. To sustain social distancing, the number of people permitted to gather in public becomes limited. Students are sent home for an undetermined period of time, and workers who used to commute hours per day are now in the comfort of their own homes attending Zoom meetings. While some may be concerned by how the lack of real-life interaction may deteriorate our community, it's hard to deny that the privilege of being protected from COVID-19 far outweighs this concern. However, not all people enjoy this privilege. There are still workers who have to work at the very front line amidst the COVID-19 pandemic, one of which is the health workers, who in fact have to directly deal and combat the surging wave of the pandemic. With the dramatically changing environment, it is truly admirable that the health workers remain dedicated to their job day and night, even when their own safety is on the line. Albeit it being a seemingly noble job to pursue, is it enough reason for health workers to persevere in such unpredictable and hazardous conditions? Or can it be that health workers are actually on the brink of giving up without us noticing? To answer this question, we conducted a survey on health workers in Jabodetabek, the heart of the spread of COVID-19 in Indonesia. In the survey, we found that the health workers' motivation at work went from an average of 5.1 to 4.4 out of 6 during COVID-19. This reduction in motivation may tell us something about how the pandemic itself affects the health workers. In addition to this, our survey found that one of the reasons that account for this reduction in motivation revolves around the safety of the health workers as well as the never-ending increase of COVID-19 cases. These two are the main factors of why their motivation at work is plummeting. But what does motivation at work really mean? And is it that important to try to maintain it? Motivation is a process that accounts for how intense an individual's will is to attain a goal, how persistent their efforts are, and the direction of their effort. This is the reason individuals hang on to a pursuit despite the many challenges that may come their way. And this ability is clearly pivotal in the continuity of the medical scene with its high levels of volatility and risk. Motivation itself is quite an extensive concept in psychology. A relevant explanation behind this phenomenon is provided by the hierarchy of needs theory proposed by Abraham Maslow, one of the most influential thinkers in the early life of humanistic psychology. According to Maslow, the many needs of human beings could be grouped and arranged into a hierarchy in which there are differences in each need's strength that determine where in the hierarchy that need is placed. The lower the need is set, the greater the strength. The level of strength would determine the prioritization to meet the need. When each need becomes substantially satisfied, the next one becomes dominant. To help you make sense of this, let's dissect the hierarchy and see how each needs are classified. Starting from the very bottom of the hierarchy, we have the strongest needs of all, the physiological needs. These needs include hunger, thirst, shelter, sex, and other bodily needs. Before shelter is provided or hunger and thirst satiated, people are likely to focus on satisfying these basic needs before they move on to the second level of needs. The second level of needs is the physical security needs. This includes the need to be secure from physical and emotional harm. For example, people who are threatened day by gang members may actively seek for this need to be fulfilled before they even move on to the next need. In the third level of the hierarchy, we have the need for social belongingness. This level explains our need to experience affection, belongingness, acceptance, and friendship. Onto the fourth level, we have the esteem needs. These needs could be categorized once more into two groups, internal factors and external factors. Internal ones include self-respect, autonomy, achievement, and external ones include status, recognition, and attention. Lastly, the apex of the hierarchy is self-actualization need. The self-actualization need is what drives humans to become what they are capable of becoming. And self-actualization includes growth, achieving our potential, and self-fulfillment. From the perspective of this theory, and with considerations of our survey, it is a possible explanation that the drop in motivation level of the workers in the health sector is caused by the unmet need for safety. As some of the participants tried to reason this decline, they mentioned the rise of health risk as the main factor decreasing their motivation at work. This implies an absence of fulfillment of one of the needs in the hierarchy, specifically the second need. The lack of safety need attainment causes the workers to be unable to strive for higher needs, resulting in a reduced motivation level. Considering that it's the lack of safety that has concerned the workers the most, it's safe for us to conclude that the solution to this problem is to increase the perceived safety in the eyes of the workers. Hospitals and healthcare organizations can always start by providing adequate support in terms of equipment, like making sure the important resources, such as protective suits, gloves, and masks, are sufficiently supplied. Other than adequate tools and equipment, hospitals and healthcare organizations should also pay attention to the mental well-being of their workers. Creating a supportive and caring environment is always important, but in a time full of hardship, it's more important than ever. Doing something as minuscule as being considerate to your workers, letting them have more flexible working hours, establishing better worker unions could go a long way to help your workers feel less stressed in this stressful condition. However, no other help is as pivotal and fundamental as preventing the dramatic increase of COVID-19 cases to begin with. Although it may seem that the number of COVID-19 cases is something so external and vastly uncontrollable for us, our behavior isn't. The simple act of staying at home is the absolute bare minimum anyone can possibly do to help the health workers toiling in the medical facility. Going outside for leisure activities, even by following health protocols, still falls short in comparison to staying at home completely. In fact, if we truly understand that there are people risking their own lives trying their best to keep the pandemic in control, then doing our part not to make that process harder is the only appropriate action. Staying at home is not just about us. It's about respecting the hundreds of thousands of health workers without whom we won't be able to see the light at the end of the tunnel, which is the long-awaited end of this pandemic. And that light is yet to be seen.